Well, thanks. And I hope, Todd, that helps you with who your audience is today, and take it away.
Okay, thank you very much, everybody, and greetings from Victoria, British Columbia. My name is Tod Litman with the Victoria Transport Policy Institute, an independent research organization. I mainly get around by walking. In fact, we have this walking machine that's a pet dog, a puppy, a pandemic puppy. And so we have to go on walks at least 2 or 3 times a day. It's a great motivator to have a dog. And in fact, you could say that if we can make sure that everybody who has a dog has a safe place to walk, we probably created sustainable neighborhoods. So keep that in mind as we proceed. I'd also mention I do a lot of bicycling. And if you look in my slideshow, the upper left corner, I live in a city with double-decker buses. Joni Mitchell was crazy. I don't know why she complained about being on the top of a double-decker bus. There's nothing more fun than to be on a highway on the upper story in a rainstorm and be able to see the world from see the highway from above. Anyway, let's proceed. And first start off with, what is our goal? Our goal is great. It's to create paradise on earth. A modest goal. In the past, maybe it was the priests and the shamans that were in charge of this. Now it's up to up to community planners to think strategically and make sure that our communities are as good as possible. Transportation affects our lives in countless ways. It's a major portion of a typical person's day. On average, people spend 60 to 90 minutes per day in out-of-home travel. And it also represents a major portion of household budgets, between 15 and 25% for a typical household. It affects people's economic opportunities and the kind of activities they can engage in. It affects our housing affordability and location, where we can live, and the costs of housing construction. Typically 10 to 20% of a house construction costs are for the garage, for the parking for a vehicle, the driveway and the garage. It affects our health and safety. It affects the quality of our neighborhood, the public realm, and community livability. It affects our local economic development, public expenses, and the fairness by which our tax dollars are spent, and it affects external costs. Now, I think it's important, it sounds like we're a bunch of environmentalists, and I am too, and I have a master's of environmental studies, and I'm committed to environmental goals. But frankly, the majority of the people in your community would probably rate environmental goals medium or low in their priority. So if we want to be successful in creating more environmentally sustainable communities, I think it's really important that we be able to frame them in terms of other community goals, economic goals and social goals and quality of life goals and health goals, and not just climate emission reduction goals. And good sustainable transportation really does achieve those goals. We just need to be able to communicate them. Now, I work a lot in the realm of sustainability. Sustainability means balancing economic, social, and environmental goals. Unfortunately, often people assume it's only environmental sustainability, but I would argue we need to be equally concerned about environmental and social sustainability. So we could ask, to what degree would our transportation system be sustainable if everybody drove solar-powered electric cars? And if you go back to this list of sustainability goals, you'd say things like climate protection, but also local environmental goals, public safety, affordability, social equity, economic opportunity, local economic development. To what degree does driving an electric car achieve those goals? Well, it does reduce our dependency on fossil fuels, and it reduces our pollution emissions, but it does nothing to reduce traffic congestion or roadway costs or parking facility costs or the cost to households of owning a vehicle, or providing improved mobility for non-drivers and therefore improved economic opportunity for disadvantaged groups. It doesn't do anything to improve public fitness and safety or reduce sprawl and protect wildlife habitat. Now, if you're going to driving an electric car is good, but it is not truly sustainable. So this matrix is one way to look at that. On the left, we can identify the various sustainability planning goals or planning objectives, things that we want to achieve. And we could ask, okay, if we spend a lot of money expanding roadways, how many of those planning objectives are we achieving? At most one. We're reducing traffic congestion. It's actually a temporary benefit because pretty soon the additional roadway capacity gets filled. But even so, you could say it reduces traffic congestion for a while. And if people drive electric or very efficient vehicles, we're reducing energy consumption and pollution emissions, but it's not achieving those other goals. But if we can create communities where people own fewer cars, drive less, and rely more on walking and bicycling and public transit, we are achieving a broad range of goals. And so this is the framework that I think becomes useful for justifying more comprehensive structural changes. So let's think about transportation equity. It's a complicated subject. I've recently published in the Institute of Transportation Engineers Journal an article that summarizes my research on equity. The best way, because of its complexity, the best approach, I think, is to identify what we could call equity objectives, things, measurable targets that we can achieve. And that includes things like making sure that our public dollars, our public resources are fairly allocated to people who share of public resources, and that we're minimizing external costs, particularly the costs that automobile travel imposes on non-drivers, that we're achieving inclusivity. We're making sure that our transportation system serves all users, including people with disabilities and low incomes, or young people or seniors, that it's affordable, and that it includes some social justice targets. So this is the framework that I recommend for incorporating social equity into our transportation planning. You can think of a city. There are, your city, let's say Albuquerque, is actually at least two cities. It's one city for people who drive everywhere, motorists, and it's a totally different city for people who rely on non-automobile travel. So a non-automobile traveler, somebody that relies on walking and bicycling and public transit, is traveling much slower. And they're experiencing the streets from a different perspective, from a very slow perspective, and the distances that they're going to travel, the places that they're going to go to in a typical day. So the places where they'll shop or go to a park or socialize are much more local. And that means a different perspective on street design and our transportation priorities, and our automobile ownership, and things like the supply of parking and road should be much different if we're going to accommodate non-drivers than if we're assuming everybody's driving. Okay, so you could say, if you're driving everywhere and that's all you care about, you could legitimately say, I want all my public resources, all the public dollars and all the road space dedicated to driving. But if you rely on walking, bicycling, and public transit, or somebody in your family does, even if you don't, you benefit from a more multimodal transportation system where you're recognizing that there are lots of people in a community who are going to prioritize the non-automobile modes. In a typical community, 20 to 50% of residents cannot, should not, or prefer not to drive for most trips. That includes young people. So think about your adolescents. It includes seniors who maybe they don't want to drive everywhere because they recognize their driving abilities are more constrained. It's pretty much anybody with a low income, the first and second income quintiles cannot afford for every adult to have their own personal vehicle. It also includes people who value the exercise that they get from daily walking or bicycling. And it includes most families that have dogs, and about 20% of households are dog owning households. And they want at least some accommodation of their canine's desire to get around by walking. So a multimodal, a fair and efficient transportation system recognizes these travel demands, including what you could call latent demands, people that do depend on driving but would prefer to drive less and rely more on walking, bicycling, and public transit. Now, if you look at most transportation agency budgets, you'd find that something like 90% of the money and 90% of the road space is devoted primarily to automobile travel. And you'll also find that because because automobile travel requires much more expensive facilities and imposes much greater external costs, that there are far more external costs, that automobile travel imposes more total costs on society by an order of magnitude. Here are the external costs. Things like noise and air pollution, crash damages that a vehicle imposes on other road users, the barrier effect, which is the delay that motor vehicle traffic imposes on pedestrians and bicyclists, traffic congestion, and parking subsidies. These are very large costs. Now, you wouldn't say that walking, bicycling, and public transit have zero infrastructure costs or zero external costs, but on a per capita basis, that is, if a typical pedestrian or bicyclist, if you look at what it costs to accommodate a typical person that relies on walking and bicycling, it's at least one order of magnitude less than the costs associated with somebody that relies on driving. So you could say there's a social equity justification for both investing more in walking, bicycling, and public transit to accommodate the people that rely on those modes, and also to reduce the external costs. So, for example, reducing roadway traffic speeds, so motorists impose less barrier effect and less traffic risk, and maybe a little bit less noise pollution on people who walk and bicycle. So you could also frame this in terms of affordability. Again, from the user's perspective, walking, bicycling, and public transit costs an order of magnitude less than driving. Automobile travel is simply not affordable to a major portion of households in your community. Now, that's not to say poor people don't own cars, they do, but it imposes very significant financial stresses. Or you could say that making sure that a community provides affordable transportation increases household resilience. It means that, for example, when your car breaks down, or if you have an accident, you can still get around, you can still get to work and go shopping. I can speak from personal experience. We've been a car-free household for the last decade, and we financed our children's university educations on what we didn't have to spend on cars. It's a huge benefit to people to be able to live in a car-light or car-free lifestyle. Okay, so for the last century, our transportation planning has primarily been oriented toward automobile travel. There's a little trick that did this. That is, transportation planning gives an inordinate priority to increasing travel speeds, to reducing delay. So transportation planners are in the past have structured their benefit cost analysis, their economic analysis, based on the assumption that reducing congestion delay and increasing travel speeds is their primary goal, and that steers our dollars toward roadway expansions and parking subsidies to make automobile travel more convenient. And that has developed this self-reinforcing cycle of increasing automobile or more automobile-oriented planning, more automobile ownership, increased parking and roadway supply, which stimulates more driving and more sprawl development, which then justifies more automobile-oriented spending. Now this cycle is beginning to reverse. So the radical new paradigm is justifying reversing some of these. But because we're in the middle of this shift, so there's a lot of old geezers that are still stuck in the old paradigm. And a lot of our transportation planning practices continue to overvalue travel time, savings, and speed, and undervalue other goals such as affordability and traffic safety and public health and infrastructure cost savings. By undervaluing those planning goals, our transportation planning process is skewed toward faster but more expensive and more exclusive and more resource intensive modes, to the detriment of the more affordable, healthy, and resource efficient modes like walking and bicycling and public transit. So in order to address what you could call the latent demands, the needs, the unmet needs for things like for goals like affordability and public health and environmental quality and resource efficiency, we need to change the way we think about transportation planning, the priorities, and recognize these additional planning objectives. Now, just for fun, you can think in terms, you can look at how this automobile-oriented, sprawl-oriented planning expresses itself. One way is to look at how the size of cities, the physical scale of cities, has changed as new transportation technologies have become available. So the old planning, the old cities like Rome or Paris or even London were primarily oriented toward walking, although London developed around their buses and trams and eventually subway, and so it was a little bit more spread out. But then you see what happened once we had the rail lines in Chicago. It expanded the scale of a city by 1 or 2 orders of magnitude, and then you get to the true automobile-oriented cities like Atlanta, very sprawled, orders of magnitude bigger than the traditional cities and what you call the compact, accessible cities. There's a social justice, or you could say a social injustice impacts associated with this. One way to think of it, one way to describe this is to think about what happened to most North American cities in the last century. So starting in the 1950s, when the US interstate highway system was being built, it made perfect sense if you were the transportation planners in a city to say that we're going to build highways to provide faster access to downtown, which in effect said the mobility, the automobile access by suburbanites to the city center was more important than the urban neighborhoods that had to be destroyed to build those freeways. So those neighborhoods were actually extremely accessible. You could live, if you lived in one of the one of the neighborhoods, one of the urban neighborhoods along a frequent bus line or subway system, it's easy to live, and it's a compact neighborhood with a nice commercial district nearby, and most activities that you need, your children's elementary school and parks and everything, are really easily accessible by walking. If you live in one of those neighborhoods, you simply don't need a car. You don't need to drive. Everything you need is right there. And if you do need to get downtown, you've got frequent bus service or a subway or a quick subway ride. Okay, to destroy that very accessible multimodal neighborhood in order to accommodate more suburban motorists was a terrible, inequitable act, but it made perfect sense at the time because we didn't value accessibility, and we didn't value affordability, and we didn't value inclusivity, and the fact that those neighborhoods that were destroyed were primarily minority and low income neighborhoods actually was considered a desirable thing. That was considered urban regeneration. We called it slum clearance. And there's actually a lot of literature in the highway building agencies justifying the slum clearance as a positive activity. Now we look back and we say it's terrible, but it's important to understand how this prioritization of automobile travel over accessibility, urban accessibility, was justified what turned out to be very bad transportation policies. You can also look at the health impacts. Automobile-oriented sprawl development, it contradicts many of our healthy community planning goals. It significantly increases per capita traffic fatality rates. It reduces the amount of walking and bicycling, active transportation people engage in. It significantly increases air pollution and noise pollution. It reduces affordability, which creates it's health problems for low-income households that can't afford. If they're spending too much money on their cars, they can't afford healthy food and healthcare. And it reduces non-drivers' access to healthcare. To put it more positively, a more efficient multimodal transportation system helps achieve many of our community health goals. There's also this interesting detail about this. The highway building, the urban highway building, was justified on the idea that it was gonna provide travel time savings, that we could build a highway and it's gonna reduce the time that a commuter needs to spend to get to work. But in fact, it does just the opposite. I helped develop what's called the commute duration dashboard. It's a website that's easily available on the internet, and it uses U.S. Census data on commute duration. That is the number of minutes that it takes to get to work, and it heat maps it. So you can go to any community in the United States, any city, and you can see how long it takes for people to get to work. And it's from various neighborhoods. And what's really interesting is that consistently, pretty much every city that we examine, the people who live in the central neighborhoods spend far less time commuting to work than people who live in the outlying automobile-dependent suburbs, despite the fact that in the center neighborhoods, the traffic speeds are lower and people are relying less on cars and relying more on what you could call the slower modes, walking and bicycling and public transit. What that means is the policies that supported more sprawled development actually did the exact opposite of what the advocates claim. They did not provide travel time savings. They actually increase the average time that people spend traveling to work or to other destinations. So when we think more comprehensively about these issues, creating more accessible, compact, multimodal communities actually achieves more of these goals. The same with affordability. All that, those longer duration trips, you could also say are tend to be more expensive. That if you have to drive everywhere, you're spending far more money. So there are other websites, what's called the Housing and Transportation Affordability Index website, that show that people who live in the more automobile dependent sprawled areas, their households spend far more money on transportation. So again, we can turn these into positive statements. We can say that creating more compact, walkable communities where people don't have to drive as much and the travel distances are shorter helps provide travel time savings and affordability benefits. It also provides very significant safety benefits. People who live in automobile dependent sprawled areas typically have about 5 times the traffic fatality rates as people who live in compact, transit-oriented, walkable neighborhoods. They also produce far lower emissions. This graph here shows per household daily emissions for various types of neighborhoods in California. And what it shows is that people who live in the central neighborhoods, or households in the central neighborhoods, drive far less and produce far lower per household transportation emissions than people who live in the more rural or automobile-oriented suburbs. Now, let's just look at one of the indicators that we can use to measure these effects, and that's walk score. So if you're interested in these issues, I encourage you to become familiar with the Walk Score website, which measures communities based on the ease of getting around by walking. It also includes transit score and bike score, so you can think of it multimodal. It produces these heat maps. So this, what I'm showing on the slide, is the heat map for Albuquerque, showing the walk score for various areas. And the way it measures is green represents a high walk score, typically over 70, which means you can get around, you could probably live without a car in those neighborhoods. That most of the things you commonly need are within walking distance. And other areas, the yellow are areas with moderate walk score, and the reddish are areas with very low walk score. And this can be used in many ways. For one thing, it can be used to identify the places that have poor walk score. And from a planning perspective, you can say, okay, we want to improve our walk score. You can set targets for more walk score. You could also say that if you're looking for a home for yourself, or let's say you're involved in locating affordable housing, you could say, we want to make sure that any house we live in or any new housing we build should be in areas with high walk score, at least a 70 walk score, which means it's good for the people who live there. It's going to make them healthier and increase their affordability. And it also means that they're producing less traffic congestion and less air pollution, less accident risk in their community. Now, in the past, a typical community, you would say, well, walking and bicycling are going to be maybe 10 to 15% of trips.
Could you pause for a question or comment on the walk score? Claude, you want to bring up your reservation, shall we say, about walk score? This is Claude Morelli, by the way, joined us after we.
Hi, Todd and Ken. Thanks for let me ask the question. I'm fighting COVID, so I'm going to be a little stuffed up here. So walk score is helpful, and we've used it a lot, but it's not perfect. We did some work in the Nob Hill neighborhood in Albuquerque, looking at walk score versus other ways of measuring walkability, and you kind of get the worst part of Nob Hill getting a high walk score, or not much difference between that part of the neighborhood and other parts that are much more walkable. So I just wanted to say that we need to go beyond walk score. It's a helpful first order approximation, but it doesn't really account for things like the quality of the sidewalks and that sort of thing.
I totally agree. Walk score the term is incorrect because it doesn't measure, like you say, it doesn't measure the actual walkability, the infrastructure. What it measures is land use mix. It measures whether, it indicates whether the common destinations that people go to. So it indicates whether there's a grocery store and a coffee shop and a pub and an elementary school and a park within walking distance of a typical house. So you're absolutely right. And I use, if you go to my analysis of what I call urban villages, and I'll put a link to some of my publications on urban villages. I define urban villages as places where you can get most of what you need within walking distance. Now it's often called a 15-minute neighborhood, but I use walk score to indicate land use mix, not walkability. So I totally agree, but it still is very, very useful because it heat maps this. It makes it very visual to an audience. And there's a pretty good overlap. It's not a perfect overlap between land use mix and things like the presence of sidewalks and crosswalks and lower traffic speeds. So we can get back to that, to the actual indicators that we should use. But I just want to add one little detail, and that is in the past, we, in a typical community, especially a more sprawled automobile-oriented community like Albuquerque, you would say that walking and bicycling might be able to achieve 10 or 15% of trips, which is not nothing, but it's not, you're still a little apologetic about spending a lot of money and road space for those modes. But the new, what we call micro modes, things like e-bikes and e-scooters, essentially double the portion of trips that can be made on what you could call a small resource efficient mode. So in the past, if you said that walking and bicycling would represent 10 or 15% of trips, maybe up to 20% of urban trips if we invest in sidewalks and a few bike lanes. Now we can double that. We can say with good infrastructure and incentives, walking and bicycling and e-bike and micro modes can achieve probably 20 to 40% of trips. If you look at the portion of trips, the portion of automobile trips that are less than 5 miles and could easily shift to walking, bicycling, and micro modes, it easily represents 20 to 40% of trips. So that is a reasonable target you can now achieve, but that can only occur if the users feel safe and welcomed with their micro modes. So it does require planning to achieve what you could call are spectacular community benefits. Spectacular benefits to users in terms of financial savings and convenience and improved mobility for non-drivers, and community benefits like reduced traffic and parking congestion, reduced road and parking facility costs, reduce accident risks imposed on other people, and emission reductions. There's a lot of work now, among planners, there's a lot of discussion about how to repair, sometimes we call it sprawl, how to take existing automobile-oriented communities and turn them into more compact, walkable communities. So if you're interested in this, I encourage you to explore the literature on sprawl repair. I suspect it's going to be particularly appropriate in New Mexico cities. Let's go through just an example here very quickly. For this, I want to thank my colleague, Dan Burden. He's Mr. Walkability. He created this slideshow I'm going to illustrate.
He's done a webinar in 15 minutes about roundabouts. So.
Yes, well, he's fantastic. Okay, so here's a typical ugly, sprawl-oriented neighborhood. The streets are designed for driving. You notice no sidewalks. Everything's low density. A lot of say a third or half of the land is devoted to parking lots. Let's see what happens if the community invests a few $1 million in new infrastructure that's you could call it multimodal infrastructure. So you build better sidewalks, bike lanes, some traffic calming with your traffic islands. You add a little green space. You put a pedestrian walkway over the highway. And here's what you get. In most communities, there's a lot of latent demand. That is, a lot of people would like to live in a walkable neighborhood if we create them. So you start seeing you say, here's the public investment. So the government has to build this infrastructure. But here's what that generates. Literally millions of dollars in additional development investments that can occur if we create that kind of neighborhood. And after a few years, it becomes one of these beautiful, traditional, walkable neighborhoods. It's perfectly achievable to change from sprawl to a walkable urban village with housing over commercial development, excellent walking conditions, low traffic speeds. We're not saying this is not car free. We're not saying you have to give up driving altogether, but you're putting walking and bicycling and public transit are given priority over automobile travel. So the cars are driving slower. They don't have as much land devoted to parking. They have to share their parking, so the parking is more efficient, and your buildings are much more oriented toward the sidewalk. Okay, so we call that part of that type of development. We call the missing middle. That is more moderate density housing types that support this more compact, walkable neighborhoods. You can do a lot of analysis. What is required to go from conventional sprawl-oriented single-family housing, where a typical house takes up 1/4 of an acre, and so you're yielding 1 to 4 people per 1/4 acre. If we can allow more townhouses, sixplexes, and low-rise apartments, we can have an order of magnitude more people per unit of land, and that allows us to create to make an urban village successful. It means that the businesses thrive because they have more customers, and the residents thrive because they have more businesses. There's some interesting research looking at this that we've gotten from this recent little pandemic. When the pandemic started, there was this assumption that contagion, the chance of getting infected and dying from the diseases, increased with density. But the actual experience showed that's not true. The densest areas, and we have a lot of research now from New York City. That was one of the first places to get the disease, and we were able to track it at a very, very fine grain level. And the interesting thing is, the densest parts of New York City had relatively low contagion rates. It was the automobile dependent outlying areas that actually had the greatest contagion rates, because the research suggests the densest areas are the most walkable. And people who live in the outlying areas, they have to drive everywhere. And even though a person driving alone in their car has very low contagion risk, most motorists have to take passengers. And it's carrying passengers in that tight enclosed space is actually a high contagion risk. Over the course of the pandemic, what we found is in the lower graph on the right, the urban areas were the ones that got that first experienced the pandemic. They were you could call them gateway areas, and so they had high contagion and death rates early on. But within a few months, once the disease occurred in the rural areas, it's the rural areas that had it worst. And in fact, the death rates in rural areas ended up being about twice what they are in the urban areas. It is not density. it is that creates these high contagion and death rates.
Can I ask a question
Todd,
about
we have
that real fast?
Go ahead, Jamie.
Sorry,
So-
you popped my public health brain.
Yeah.
Did they compare these results based on kind of other patterns that we saw in pandemic prevention? So we know that right now, typically urban cities tend to be leaning more on the blue side of the political spectrum. We also saw a greater uptake of vaccination and masks, as well as it ripped through some of the higher urban areas. Then we presumably then it kind of, the disease will spread and try to find populations that haven't been as infected so that it can spread more readily there.
Sure.
Although the other piece that I would mention for this is we know that weight and health was a big piece of this and in a more dense walkable area. So I'm just curious, did they take a look at how
Yes.
these results factored in with all of those different variables coming into play?
Yes, let me first of all say that as a researcher, I am forever impressed with the quality of research that comes out of the medical community. So us planners, we are amateurs compared with the very sophisticated research quality that comes from the medical community, medical researchers. And the pandemic has been an incredible example of how brilliant, very capable researchers can have worked very hard. Stepping back, I would say that despite the many challenges that the pandemic has presented, it's actually been a spectacular success story from the perspective of the research of the medical research community that was able to identify the diseases and develop vaccines in an incredible rate and identify ways that we could be healthier, very effective, considering how we had to go from zero knowledge to managing this huge challenge within just weeks and months. It's been spectacular to watch that. So despite the problems, so the quick answer to your question is yes, rural areas have many of the high risk factors, including aging population, higher rates of obesity, and underlying health risks, things like diabetes, more reluctance to engaging in the preventive strategies, including wearing masks and being vaccinated, and slower medical response, not so sophisticated public health areas. And actually, New Mexico, those disparities are particularly strong, I believe, in New Mexico. So I don't. First of all, let me express my appreciation and respect for everybody in the public health community for the good work that was done, and share your frustration with the opportunities that were missed when you identified excellent health strategies that were not followed. So I just want to bring it back to this one issue, that what the research so far indicates is that the highest risk travel, any form of enclosed travel, is high risk, whether it's in a bus or in a car. For a while, there was a sense that public transit was particularly dangerous, but that does not turn out to be true. And the lowest risk is if you rely on walking and bicycling. So unenclosed travel is the safest from a contagion perspective. And it's also the healthiest. Walking and bicycling are the healthiest. So you're getting these multiple benefits from living in a walkable community. To me, it's a very positive message. We can say that some of the same strategies that reduce your contagion risk also make people healthier and increase affordability and social justice goals and reduce pollution emissions and reduce government costs for roads and parking facilities. So the strategies that we're talking about, creating more compact multimodal neighborhoods, what I call urban villages, and some people call 15-minute neighborhoods, or whatever you want to call it, those provide real, very large and diverse benefits. And it gets us away. I think this is the key. You know, you guys, unfortunately, you're stuck in this political framework. You know, this you define yourself on who you hate. Well, I wouldn't say hate. People all too often define themselves on who they criticize, and I think that at least some of the benefits of smart growth, new urbanism, urban villages actually break through this polarization, and can be areas where people can agree. In fact, one of the I think real opportunities is that local businesses can benefit a lot. Think about this. Think about this purely from a local economic development. How many tax dollars can you generate per acre going from this to that? How many jobs and tax revenue can you yield per acre? And so your chamber of commerce, your local builders, your local trades unions should all be great supporters of the kind of development policies that allow this to occur. And I don't know what's going on in Albuquerque and other, New Mexico cities, but in most successful growing cities that I'm familiar with, housing affordability is a huge problem. And there's this issue of aging in place. People want to continue living in their neighborhoods, but they want to go from their single family house to, say, living in a condominium or a townhouse or an apartment, and they need to make sure. So it's now is the time to start planning for our future selves. So these are ways of looking at the development policies that get us away, I think, from left and right politics or homeowners versus high income homeowners versus low income renters. We can start thinking about the development policies that create mixed use, mixed income, economic development oriented policies. And by the way, they also help create healthier and lower polluting communities. Okay, so let's go to any more questions while we have a few more minutes. I want to make sure that we cover any questions or comments.
Why don't you advance
Well,
to your
Ken,
next slide, and then go ahead, Steve.
Ken, you mentioned Dan Burden's workshop. Can you put that link in the chat,
Yeah,
please?
I don't have it right now.
Oh, okay.
So,
I'll look for it. Okay.
okay.
The only question I had, and I put it in the chat, Todd, was, oh my goodness, how we encourage this. You covered some of it. Certainly developers would benefit in terms of the longer term economic development and the flow towards. We just need to find a lot of ways to encourage this. Certainly mayors, anyway, any ideas on that? More ideas?
Right. So, I mean, we have this terrific product. If I was Dan Draper and somebody came in and said, I have this product that makes people healthier and saves money and supports local economic development, can you sell it? And Dan Draper would say, great, let's frame this. I would say our challenge is that we often fall into this narrower perspective where you end up especially, let's say, if you frame it in terms of environmental. If you say, oh, let's do this, let's reduce automobile travel to achieve our environmental goals, you're gonna leave some people, they're gonna be alienated. But if you frame it in terms of creating a more livable and affordable community, where the local businesses will have an easier time attracting employees and customers, then I think you're going to be more successful. So it's our challenge to frame this and to identify the full benefits of these kind of reforms, and to present it in the way to present it to each audience. So on Monday, you might be speaking to the Chamber of Commerce, and you frame it, you present the benefits that resonates with them. On Tuesday, you're speaking to the public health authorities, so you talk about the health benefits. On Wednesday, you might be speaking with a bunch of Marxist, advocates, and you talk about the affordability and inclusivity benefits. On Thursday, you might be talking to seniors, and you talk about aging in place. So it's our challenge, I think, to frame this, but we have a terrific product to sell. What do you think? So I just put in the chat box a few of my links to a few of my columns on this subject, but there's far more information. So if you have any questions, you can contact me. I'll put my email in the chat box. I'm happy to stay around. I'm not in any hurry, but I recognize that we're about at the limit of the official workshop. So if anybody has to leave, I won't be offended.
I have another question kind of about how we sell this and some of the challenges I've run into with some of the either new street designs or some of the streets that I'm trying to do really a redesign of in my city. And I feel like there's a because I don't think this is universal, so I'm kind of careful how I'm phrasing this, but the kind of traditional traffic engineering has a very different viewpoint. And this has been one of the challenges that I've really run into. Now, the city of Santa Fe, we do not have a traffic engineer on staff. We do contract out. So, and then as an elected official, I am still learning how to unlearn all the things they have taught me about being a woman and trying to remember how I just kind of push my initiatives. But I do find that can be a population that when we're having this conversation, and I've spent a lot of time talking about narrowing roadways. I don't want wide open 14-foot medians. I want them to be built out. I want wide bike lanes with protected, and kind of getting some pushback there. And so I'd love to hear a little bit about kind of, it really feels like a kind of a new philosophy that needs to be adopted by other municipal members.
There's literally a paradigm shift, a change in the way we define problems and evaluate solutions among transportation engineers. And there's a bunch of old guys, and they're almost all guys, a few exceptions, that I think need to retire or die before we're going to get the new paradigm. I will put in the chat box my article that was published in the ITE Journal, the Institute of Transportation Engineers Journal, on the new transportation planning paradigm. So this is, I totally agree. Now, the good news is that there's a bunch of smart, young transportation engineers and planners. They tend to be much nicer and better looking than the old geezers. And they are happy. They know that more multimodal transportation, sometimes called complete streets planning, or there are many other terms, multimodalism, but they're keen for this. A lot of them are bicyclists, or have lived in multimodal communities. So yeah, there's different people are at different stages in this paradigm shift. There are, or I should say, different practitioners, the transportation engineers and planners. Some of them, there are still plenty of practitioners that still think that their job is to make driving easier and faster. There is a huge shift now from mobility-oriented to accessibility-oriented planning. So accessibility-oriented planning recognizes that things like land use patterns, proximity, density, land use mix are as important in your ability to, in the speed with which you can access services and activities as your mobility. So I don't know if you've been following it, but there are a number of excellent publications now on how communities can shift from mobility-oriented planning to accessibility-oriented planning. And there are a couple jurisdictions, particularly California and Washington State, that have inverted the whole process by establishing VMT reduction targets. So now in California, anytime you're planning a development or a transportation project, it's evaluated based on whether it increases or reduces VMT. And in the past, the assumption was, yeah, we want to increase VMT. We want to make it possible for people to drive faster and farther. And now we've just inverted that. Those jurisdictions, California and Washington State and a few other places, now have VMT reduction targets. Now they're often framed as a climate action, but really what they do is they force the planning process to shift from mobility-oriented to accessibility-oriented planning. There's a wonderful organization called the State, hold on just a second, I will look it up. The SSTI. Anyway, I'll put in a link to a couple of their reports. So there's a lot of professional, there's some great work going on among the professionals as to how to guide this shift. It's up to us it's up to policymakers and advocates to make sure that your community is applying this kind of state of art approaches. And so, you know, if you need more information on this, send me an email and I can direct you towards some of this, some of the new approaches.
I would love that. I am a self-described nerd and love reading anything and everything. So I will absolutely send an email and just bombard me with articles.
Yeah, another good source is the National Association of City Transportation Officials. So they produce all kinds of really great stuff. And I'll put in the chat box a few links. Anything else?
I think we can go on for hours. However, we should probably break the official portion of the webinar. And thank you so much, Todd.